is the Emergency Medical Minute.
This is Ryan Kirch with another Medical Minute. To celebrate the start of football season, my topic this morning is shoulder separations, also known as acromioclavicular separations. The first point that I do want to make for a lot of people that they do get confused by this is that a separated shoulder is different than a dislocated shoulder. So when you dislocate your shoulder, the ball and socket have become dislocated. When you separate your shoulder, your clavicle becomes separated from your scapula, and that is where you get the acromioclavicular separation. So typically you're going to get these injuries from direct blows or falls onto the shoulder, typically, again, most commonly in football as far as sports go. You can also sometimes see it when a patient has a fall on an outstretched hand, or they fall directly on their elbow, kind of causing a superior disruption, kind of upward trajectory of the elbow onto the shoulder. Treatment obviously is going to be with NSAIDs. Exam, you're going to see that there is pain directly over the acromioclavicular joint. They're also going to have pain when they try to adduct their arm, and typically they're not going to be able to raise their arm above horizontal without significant pain. Diagnosis for mild ones, it's simply clinically. If you do start seeing deformities, you want to start thinking about taking x-rays. It's beneficial to consider bilateral x-rays to compare the widening of that joint on the normal side versus the abnormal side. Degrees of separation are really, for treatment purposes, not really significant, but just for your knowledge, a first degree is just a simple partial tear. You'll see no widening on an x-ray. A second degree, you will see widening of the joint on x-rays, and then a third degree, it's going to be a fully torn joint, and there's going to be a large amount of separation and probably some upward displacement of the clavicle compared to the acromion. Treatment, again, NSAIDs is going to be most important, and sling. What's going to be really important, though, is with slings, you want to make sure that they're doing early range of motion exercises as quickly as they can tolerate it. So at the very least, having them getting their arm out, even on day one, bending over and doing pendulum swings. So essentially, they bend over at the waist, let their arm hang, and just kind of circularly rotate it to get range of motion exercises. First and second degrees are going to recover really well. Usually within 2 weeks, they're going to be feeling better. And you should recommend no heavy lifting for up to 6 to 8 weeks. Otherwise, for third degree, you want to consider transferring or referring to orthopedics. But otherwise, again, these are all going to be simple, expectant management and likely physical therapy referrals. A vast majority of these are not going to need surgery, but again, that's what an orthopedic decides. So again, keep an eye out for these, especially with football players as this football season begins, and hope everyone has a good day.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.